Thank you all for joining me mid-morning, late morning on a Wednesday, first week back for many folks to work. My name is Scott Patterson. I'm the statewide behavioral health manager for the Administrative Office of the Courts in New Mexico. I want to start off by thanking the partners, the Behavioral Services Division and the Z team for their leadership, collaboration, and work to improve the court and community response to individuals with mental illness in New Mexico. I also want to extend some thanks to the National Center for State Courts and the Council for State Governments for their partnership, and also the Bureau of Justice Assistance for providing the funding that would make all of these projects possible. I'll be recording, like I said earlier, I'll be recording the webinar today. I should have it ready to go by probably late Monday or early Monday at the latest for anybody who wants to see it, or if you have team members who want to see it. The goal of the webinar today is really to provide a brief overview of the application itself, and also a brief overview of the sequential intercept model. Part of the reason why we're going to go over the sequential intercept model is many of you are already aware of it. For those of you who aren't, I want to highlight some of the evidence-based best practices that can occur at each one of the intercepts. The application due date itself is going to be 3 p.m. January 14th, 2022. The application will need to be submitted electronically, so you can submit it to me via email. The goal of the funding for this application is really to assist communities in developing projects that will improve outcomes for individuals with behavioral health needs. So that could be mental health, substance misuse needs who are involved in the justice system, by providing opportunities for intervention that have the potential to result in diversion from and/or successful exit from the criminal justice system. This is an opportunity for you to be innovative in your approaches to improving outcomes. If there's something that you as a community or you as a team have been talking about or have been discussing for several years that you'd like to try, this may be a good opportunity to apply for funding to make that a reality. The priority areas, really when we're looking at the plans, the plans that address interventions that target female offenders, so female identified individuals who are involved in the justice system, rural communities, high poverty areas, under-resourced areas, and interventions that intercept 0 and 1 will receive special consideration. I want to highlight that we're encouraging teams to submit applications for projects that are innovative in their approaches and that seek to use evidence-based practices to improve outcomes for the individuals who have potentially multiple system involvement. We're also going to be talking about data. I want to highlight for you that there is an expectation that each project that is selected will collect data throughout the process. The selected projects will also have some technical assistance from Administrative Office of the Courts and from National Center for State Courts as appropriate and as needed throughout the process. This can include developing data collection and how to report the data. So how to make sure that the information that you are providing, the intervention that you're providing, actually can have possible or positive outcomes. I'm going to move into a brief overview of the sequential intercept model, highlighting possible best practices at each intercept. And these best practices, some of you may already be engaged in these, or some of you may have been thinking about doing these for years. So when we look at the sequential intercept model itself, it is kind of a way to look at the system and the way to look at how people move through the criminal justice system and how people move through life. With our cross-system collaboration partners, so with partners in the community and from the executive branch, we have really been adopting the sequential intercept model lens to see how people engage in the process and how people engage in the system and how we can move them out successfully. So the sequential intercept model really encourages systems to leverage existing and potential resources to develop responses for individuals with mental illness, with behavioral health concerns, substance misuse challenges that will work in and for the community. So it's an opportunity to develop interventions that are actually going to be meaningful for your community. So knowing that what works in Jal may not work in Clovis. The goal is to provide interventions that will reduce involvement in the criminal justice system for individuals. It encourages cross-system collaboration, so it encourages communities to ensure that all stakeholders are not only at the table, but that they're also actively engaged in the collaborative work that's needed to reduce criminal justice system involvement, and that's needed to connect individuals with resources or opportunities to move themselves forward. Collaboration in the sequential intercept model should occur across the spectrum of engagement, so it should occur at all times. The sequential intercept model is often initially implemented through a community mapping framework. So some of you have already participated in a community map. And really what a SIM mapping does is it brings together stakeholders in the community to identify resources and gaps at all entry points along the sequential intercept model, with the goal of assisting communities in targeting efforts to effectively reduce criminal justice system involvement. So SIM mapping exercises help communities to really identify what are the resources we already have, what are some of the gaps we have, what is some of that low-hanging fruit that we can tackle, and what are some of those longer-term goals. When we look at sequential intercept model, this is the visual representation that SAMHSA typically uses. It's a linear model developed initially by Policy Research Associates, currently in use across multiple systems as a framework for engaging in cross-system collaboration, and really an engaging for work that improves responses to individuals with the goal of improving their outcomes. So how they are able to extricate themselves or from the justice system or be involved in kind of meaningful activities. It's important to note that while this example and while the model is linear in nature, individuals often will enter and exit at various intercepts. So you may have an individual who exits, at intercept 2, comes back to 0, or somebody who leaves at 4 and then comes back at 2. So I'd encourage you to look at it as an kind of a good lens to look at, but don't get hung up on the fact that it's linear. It doesn't have to progress that way. When we look at sequential intercept model best practices, we're really looking at the best practices that can potentially occur across the intercepts. I'm going to go through a couple of the examples, and these may be things that you all want to consider applying for. So it may be something that is similar to a program that you would like to see in your community. At intercept 0, we have a couple, 3 best practices. Mobile crisis outreach teams and co-responders. So that can be behavioral health or other types of practitioners who can respond or co-respond to individuals in a behavioral health crisis. We have emergency department diversion. That can be triage services, embedded mobile services, or peer support specialist services that are working with those individuals who access behavioral health care or who are accessing the justice system and then sent to an emergency room. Police-friendly crisis services, by that what we're talking about is stabilization services. So potentially walk-in crisis treatment centers, crisis response centers, or respite in lieu of taking an individual to jail. Sometimes this can happen in some of the communities in New Mexico. It can happen by having like a drop-in center or a living room model center or a community response center in order to make sure that people do not have to be hospitalized if they don't need it or incarcerated if they don't need it. When we look at intercept 1, we're looking at dispatcher training, specialized police responses, and high utilizer specific interventions. So when we're talking about dispatcher training, we're talking about targeted training to assist dispatch, so individuals who work in dispatch, to recognize behavioral health crises or the potential symptoms or cues that somebody's in behavioral health crisis in order to send the appropriate team. So that might be a crisis intervention team. And it also is important, you may want to consider this as a project to make sure that dispatchers are able to provide the relevant information to whoever's responding as well. When we talk about specialized police responses, we're really talking about targeted training for officers, so law enforcement officers in behavioral health interventions and in community partnership and engagement. Another best practice at Intercept 0 is use of specific engagement intervention services with coordinated follow-up to encourage treatment connection. When we're talking about high utilizers, we're often talking about individuals who have a lot of justice system involvement that is related to less than optimal management of their behavioral health symptoms. This can be something like a forensic navigation. It can be high intensity or high engagement case management. It could be community restoration. When we're looking at Intercept 0, we're looking at how do we engage individuals with those high utilization needs in a way that's going to help them not utilize the justice system. When we look at Intercept 2, we're really talking about a couple of potential best practice opportunities. Screening is talking about universal screening and universal use of a validated brief screen, potentially and often by non-clinical staff early in the engagement process. So this may mean that in jail booking, in a police holding cell, in a court lockup prior to the first court appearance, that individuals are being screened to determine what their behavioral health needs are to see if they can be diverted or connected with services that are important. When we talk about data sharing, we're really talking about being able to speak the same language and share the same information. And research has shown that data sharing between jails and providers allows for improved continuity of care. It also allows for a reduced potential reduction in trauma exposure. So individuals often are asked the same questions about their behavioral health repetitively. And when we're doing a good job of sharing information that respects the rights of the individual, it reduces the amount of time somebody might have to tell their story. Pretrial supervision and diversion can effectively reduce incarceration of individuals with low risk of criminal behavior and can improve behavioral health outcomes because it can connect them with services that are meaningful and that will meet the needs and help them manage their symptoms in a way that does not result in criminal justice system involvement. When we're talking about Intercept 3, we're talking potentially about treatment courts. Those are for high-risk, high-need individuals. Many of you are familiar with treatment courts across New Mexico and across the United States. New Mexico, it is really looking at specialized court dockets that meet the specific needs of an individual who is high risk, high needs. For example, DWI court, young adult court, drug court, mental health court, or veterans treatment court. Jail-based programming and healthcare services is making sure that when an individual is in an incarceration system or is incarcerated, that they're able to access services that are meaningful and that help them to stabilize. Many of our cross-system collaboration partners are not aware that jail healthcare providers are constitutionally required to provide behavioral health and medical services to detainees, to individuals in their care. And collaboration across the board allows for continuity of care. So it allows an individual who is in the justice system experiencing behavioral health needs to get these services that they need in order to stabilize. Veterans Justice Outreach Specialist, if you guys are not aware of that, there are veterans justice outreach specialists who are working with individuals who are in the criminal justice system. And collaboration with the VJO specialist improves continuity of care and improves outcomes for individuals who are identified as veterans because they can connect them with meaningful services. When we talk about best practices under Intercept 4, that's really transition planning by the jail or in-reach providers. So it effectively improves the reentry outcomes by organizing services. So by allowing people to connect with the services they need to meet a specific need of an individual in advance of their release. So this could be making sure that somebody is coming into the jail and talking about supportive housing, talking about getting somebody on insurance if it needs to be, or connecting them with a treatment provider if they have that identified need. When we talk about medication, providing a minimum supply of 30 days worth of medication upon release diminishes the likelihood that an individual will not be able to maintain symptom management immediately after release. Historically, what has happened is individuals might be on a specific medication prior to entering detention and while during detention. And when they're released, if they don't have access to the medication, they may have the capacity to deteriorate. So when we're talking about the last potential I want to talk about Intercept 4 is a warm handoff. So when a corrections officer or detention officer or a staff who's in the facility is able to connect somebody with services in a meaningful way, it improves the likelihood that an individual will actually engage in the services. When an individual is released with only a referral, the likelihood of engagement decreases. When we look at Intercept 5, we're talking about specialized community supervision caseloads for people with mental health or behavioral health disorders, meaning that the officers that are working with them, if they're on community corrections, if they're on adult probation, if they're working with a court compliance officer, providing specialized training and specialized caseloads that allows the officers to employ problem-solving approaches that will actually work for the individual. You all know that MAT, or medication-assisted treatment for substance use disorder, can effectively reduce relapse and overdose episodes. And when we talk about access to recovery supports, benefits, housing, and competitive employment, in reality, access to housing and employment are as important for justice-involved individuals as access to behavioral health care. And access to these programs, if somebody is released, has in-reach and is released to supportive housing or is connected with services that are meaningful for them, the outcomes can be significantly improved. We're now going to move into a brief overview of the application itself And like I said earlier, there's going to be time at the end for any questions you have regarding the application. So when we look at the application questions, questions 1 through 6 are fairly straightforward. Please make sure that you list the person who is going to be the primary contact for the pilot project if it's selected. Please also make sure that you have the application signed by whoever your justice system, your judiciary system partner is. That might be the chief judge, it might be the presiding judge, it might be a court administrator. And also, I think this probably doesn't need to be said, but make sure that you sign. If you're submitting the application, make sure you sign it as well. We need to make sure that it is legible and it's in a way that can be understood. When we move on to some of the other questions, so question 7 on the application, this is an opportunity to indicate whether or not your county meets the criteria for each of these demographics, as well as an opportunity to provide a brief explanation of how your county or your community meets this criteria. Please note that on the application, there's an active link in the application that may help you in determining this, may help you determine whether you meet that demographic criteria or not. When we move on to question 8, we're asking you, when you answer this question, you'll need to be able to articulate some specific goals of the project, the specific goal or goals of the project, the target population you intend to serve, and it may be more than one targeted population, the specific need or needs that you intend to address, and the sequential intercept model intercepts that your project will address. Knowing that some of the projects that we expect to see may only address one intercept, and some projects may address multiple intercepts. Please note that your projects can articulate, you need to articulate if it is going to be more than one intercept, and please feel free to highlight what data you might collect throughout the process and how you might collect this as well. When we look at question 9, so question 9, I look at as the justification question. This question is an opportunity to clearly articulate how, if your project is implemented and selected, how there will be improved outcomes for the individuals and how the community as a whole will benefit. It's an opportunity to highlight if there's any historic data, historic work that's been done on what you'd like to address, to highlight that, and to really say, how is this going to be different and how will the whole community benefit? And specifically, how will individuals with behavioral health needs, substance misuse needs, mental illness needs, and criminal justice system involvement benefit from it? Next 2 questions are fairly straightforward. Your anticipated start date and your anticipated end date. Please indicate your start date and your end date for your pilot project. And when you are trying to come up with an anticipated date, know that we're going to try to make the review committee, the selection committee has the intention of the goal of making a determination by January 28th and notification by January 28th at the latest. And that start dates may be impacted by the contracting process. So start dates may be impacted. So I would encourage you not to write down that your intended start date is February 1. So make sure you give yourself a little bit of time, and please make sure to give us a little bit of time as well. We're going to move on to the next question. So we're looking at question 12. Question 12 is really an opportunity to highlight how your pilot project will meet the needs of any or all of the priority areas. You've answered that a little bit earlier, but this is really an opportunity to highlight if your project will specifically serve female identified individuals, highlight that and give us some narrative, give us some justification or some explanation as to how it will. When we look at the implementation plan, please make sure to articulate the specifics of how you intend to implement the pilot project, including who is responsible, so which partners are responsible at what point, what partners are going to be involved, what evidence-based practices might you consider using, if and how your approach will be innovative, and what you might view as a success. So how will you know if your pilot project is successful? When we talk about the implementation timeline, it's really an invitation for you to talk about the specifics of the timeline of your project that you're going to implement, to include who is responsible for each step and how, if there's multiple partners, how are you going to manage making sure that individuals are able to engage in the process in a way that's meaningful? Question 15 is an opportunity for you to indicate the collaboration partners that you intend to work with, who will be involved, those individuals who are going to be involved in the project, And please make sure that you include their agency, their role, and their expected participation. You can do that as a percentage. You can say, you know, the PD's office is going to be involved in this process, in this project 20% of the time. Or if you're not 100% certain, I would say make your best guess as your plan as to how people, what level of involvement they're going to have. When we look at the question that may be causing some of you kind of the most amount of agita is the budget summary question. And the budget summary should adequately and accurately reflect the proposed costs associated with implementing the plan as outlined in your application. Please make sure you include your method for determining the cost of each part of your request in the budget. And some of you may find it beneficial to take a look at the State Justice Institute if they have some budget examples, or you may also find it useful to look at the OJP budget detail worksheet. It might be helpful for you to review that when you're looking at the putting together the budget. It's really the most important thing I want to stress when you're looking at your budget is being able to clearly articulate and explain why you're asking for what you're asking for will meet the needs of the plan itself. On the question 14, the reason we asked this question, I want you to indicate if you've received federal funding in the past 5 years. Part of the reason for that is some of the funding for these projects is going to come from the Bureau of Justice Assistance, from the JMHCP grant. And so there may be some additional requirements that programs might have to meet in order to qualify. So if you haven't received federal funding in the last 5 years, not a big deal. If you have, please make sure that you indicate that as well. The pilot project application timeline, application deadline again is going to be 3 p.m. on January 14th. The application review and selection is going to occur after we receive all of the applications. And our goal, our intention is to make sure that we notify the programs that are selected, the pilot projects that are selected by 4 p.m. on January 28th. I'm going to go ahead and I'm going to put this up here for about 60 seconds so you can write down my phone number or my email address if you have any questions. I'm going to stop sharing and then we're going to open it up to any questions you might have about the application. So I'll share this for about 30 more seconds. All right. Absolutely, and I'm happy to, for those of you who would like the PowerPoint as well, I'm happy to send the PowerPoint so you can take a look at it. And I will also, like I said earlier, I will send the recording. Hopefully we'll have that ready by Monday to any of you who want to see the recording if you have any questions. So the application itself is, I think, fairly straightforward. It really is an opportunity for you all to be innovative in your approaches. And like I said at the beginning, if there are things you've been talking about as a community for a while that you want to do and you haven't had the funding to do it, I would encourage you to apply to see if this can be part of that process. Any questions you all have, please feel free to either unmute yourself, raise your hand, enter the questions in the chat. I'm a fast talker, so we have plenty of time for questions. And if not, y'all can have some of your day back. Any questions at all? Yes, Paul.
What is the range of funding? Is there a precondition to the amount of funding that one gets? How much do you have available, and how many awards do you intend to give?
So it depends on what folks ask for. Our intention is to award at least 6 projects. And so on the application, we highlight that the potential range is between 40,000 and 100,000 over the course of 2 years. And really it'll determine, I would encourage people when they're looking at their application and applying, most folks when they're applying for a grant are going to apply for $100,000. If you think you can get it done for cheaper than that, feel free to highlight that. If you feel like you need the $100,000, just make sure in your budget that you articulate why. So depending on who applies and how many people apply, we may have more than 6 recipients. Hopefully that answered the question. I noticed my My internet at the court system, the internet is maybe still on vacation. So looks on my side like it's slowing down. Any other questions?
I have a question.
Yeah, Susan.
Hey, Scott. Thank you for this. I know you probably sent the link out to the application before. Can you send it out again? For
Absolutely,
those
will
of us who
do.
can't remember where we stored it.
Will do, and I'll have an ask, Susan. I know you. If I don't know you and we haven't had conversations before, please send me an email.
Okay.
And I will send it to you if you want that. Susan, I'll make sure I get it to you by today. But if you don't, if for some reason we haven't had the opportunity to have a face-to-face in the past, if you want the application, just reach out via email. I'll send it to you again. And know that the application is, in my opinion, since I'm not having to fill it out, fairly easy to fill out.
Looks simple. Thank you.
Any other questions? And Lauren, absolutely, I'll send the link to the recording. I'll send that to the email for everybody who has registered for the for this webinar. So it should be ready by Monday, I believe, at the latest. Any other questions? So there's 39 of you, so I'm guessing we can expect 39 applications then. So that may make our process a little bit longer. Again, I want to highlight, it's really a good idea if you are able to talk about what evidence-based practices you may be interested in using, what kind of data you want to collect, knowing that we will give you, we will help you collect some specific data that we have to report back to the federal government, and also being able to highlight if you think your program, your potential program isn't necessarily innovative, is it innovative for your community? And if it is innovative and it's using not evidence-based, but evidence-informed practices, highlight that as well. Because we know, having been involved in some federal research, I know that the pandemic caused some challenges for some people who were doing research in order to get evidence-based status. And so if you're using something that's evidence-informed, wonderful. If you're using something that you guys have developed as a team in your community, equally wonderful. And the other thing that nobody's asked yet, but I want to encourage you, if there are 2 projects that you feel like, you know, the 12th Judicial District really wants to do 2 projects, and the judge wants 2 projects, or you as a team want 2 projects, feel free to submit 2 separate applications. So you're not limited to 1 application for town or community or county. Really look at how could you do things in a way that's meaningful. And I would encourage you, if you are going to submit more than 1 application, make sure it's not duplicative. So make sure that they're really targeting different things. So you may want to do a mental health court, and you may also want to do community restoration for individuals with forensic needs or for individuals with competency needs. You may want to develop a supportive housing program that will allow for connection to therapy services, case management services, medication services, and have people who are exiting the system or who are at danger of entering the system have a secure place to stay. So make sure that you're being creative and thoughtful. And Paul, I will send the PowerPoint out to those of you who were on the registration. I'll send that out. I'd like to say today, but I know my schedule, so I'll try to get it to you by noon tomorrow. Any other questions? You can randomly call on people. Or if you guys don't have any other questions, or if you have a question Sunday at 2 p.m., call me, send me an email. Know that on Sunday I'm not going to respond, but I'll respond back to you on Monday. So if you have that 3 a.m. burning question, send it via email and I'll respond. All right, if there's no other questions, please feel free to, I'm going to say, go out in the world and do great things with a mask and socially distanced. Or stay at home if that's better for you. And I'll stay on for another 20 minutes if anybody has any questions. And Dev, I'll get the recording out to you probably by Monday at the latest, so you can take a look at it, and I'll also get you the PowerPoint today.
Thank you, sir. I was just about to write you an email about that other question I had for you prior to the meeting. I don't think we need to discuss it in general, but if you
Other-
care to,
other
if you
folks
have an
may
answer,
have-
that's fine.
Yeah, other folks may have that question as well. I think if you can justify how the personnel cost will be, like how it's appropriate and how it will help the project go forward, then I would encourage you to include it in your application. So if you're saying, we want to have our pilot project is going to have a forensic navigator or a high intensity case manager or a certified peer support worker, and we'd like to use the dollars to pay for that, figure out how to highlight that and articulate that in a way that's meaningful. And also articulate how is that actually going to improve outcomes for individuals and how does it target the population? So if you have a CPSW who's working exclusively with under-resourced female individuals or female identified individuals, that may be justifiable is the word I was looking for.
Okay, I would love to hear from you because I kind of want to run some language by you about how that gets articulated. But we don't have to do that here. Thank you very much.
Perfect. Any other questions? And the other thing I'll say for those of you still on, make sure you use spell check. And then make sure you have somebody else read it. And I'll say that because often I'll send things to Michelle, who's on this call, and she's very generous in saying, that's not English, or that's not proper pronunciation. So when we write things, we don't always catch our own mistakes. So if you have a second reader, try to do that as well. And Paul, Mr. Jenkins.
Yes, we're considering having Rio Grande ATP be the applicant in collaboration with RAIN. And I'm wondering if that would be acceptable in order to get our Colfax Echo program going.
I think the review committee would certainly be willing to review that. And I think when you look at the application, it needs to have the support of the court system. So as long as you have support of one of the judges or one of the administrators, and they sign off on it, and you're able to articulate how it will help to improve outcomes for individuals with justice system involvement and behavioral health needs.